Uh, Thanks very much, Martin. I probably, like David Cashley, have sort of tried to rewrite this talk quite a few times over the last number of days, especially on advice on different friends. I'm here to tell you why we are, or how, a bit about my journey with podiatry over the last number of years. Like you all, it was great to see friends here in Sligo from conferences in the past. I'm, as usual, on the morning after the night before, quite hungover. Whoever decided to buy tequila last night probably wasn't quite a good idea. You know, my journey in podiatry has been a lot in clinical biomechanics. Apparently, Trevor and I are going to do a biomechanical Pepsi challenge later on. Do you remember that, Trevor? No. You know, we all develop our clinical skills. That's why we're here. And there's been great talks over the last, yesterday and this morning. And we're all very good at technically learning skills to better help our patients. But of course, if patients do not understand exactly what we do, then how are we supposed to then bring them on that journey that we want to do to them? So if we can have the next slide, please. Why do they want to pay their hairdresser more? I don't have that problem. Yeah, I do my own. It's instant gratification. When patients come to see us and we talk about the plan that we're going to give them, they want what we do, but then there's well, it's going to take a week, a month, the rehabilitation. It's a journey that they have to go on, and there's going to be some pushback. When people want to pay for their, people know what they're getting when they get their money out and pay their hairdresser, when they pay their, when they pay the car in the garage. When you go onto Amazon and you log in, you get your credit card out, and the next day DHL come and you know exactly what you're getting. When patients come to see us, they do not know us enough and trust us enough to know what the result is going to be. Can I have the next slide, please? We live in a bubble. We're trained, we're the foot health experts. You can talk to me later on about my own pet theories about how the courses should be reorganized. We're taught to talk to people technically, but we don't actually want to, we're never actually told how to talk to patients so that we can actually change how the outcomes that they get. We spend a lot of time as a profession worrying about what other people are doing. The unqualified, the great unwashed. Yeah, that's it. All the male bases, everybody talks about they're doing this and protection of titles. Patients don't give two shits. Honestly, they want the outcome. You know, if the guy sweeping the street can fix my heel pain or my Achilles problem, that's what they want. Can we play the video, please? So this is a quick vox pop that we did.
Right.
Hi, so Alan, you can tell us, do you know what gait analysis is?
Gait analysis?
Yes.
No idea.
Okay. Frank, would you mind telling us, do you know what gait analysis is?
No.
Or would you mind telling me, do you know what gait analysis is?
No.
No. Christina, can you tell me, do you know what gait analysis is?
No.
Okay. And do you know what would happen if you had a gait analysis? And do you know what a biomechanical assessment is?
Something to do with the car?
Okay.
Alan thinks a biomechanical assessment has something to do with his car.
Couldn't tell you.
Okay. And do you know what a biomechanical assessment does?
No.
No. And if somebody said you had a biomechanical assessment, what would that mean?
Don't know.
Okay. Pamela, how's things? A couple of questions. Do you know what a biomechanical assessment is?
No. No idea.
Okay. And do you ever heard of an orthotic?
Orthotic? No.
Okay. And have you ever heard of an orthotic?
No.
Okay. And do you know have you ever heard what an orthotic is?
No.
Okay. And if you had a pain in your foot or leg, who would you maybe go to see?
A chiropodist.
Okay. Right. And what is
A leg though would be physio, no?
Okay. That's great. Thanks very much.
And if you had a pain in your foot or leg, who would you go to see?
Chiropodist.
Okay, great. Thanks very much. Okay, and do you know what a podiatrist is?
Yes, I do now.
You do, you do now. But before this, if you had a pain in your foot or leg, who would you have thought about going to see?
Probably the doctor.
That's great. Thanks very much.
You know.
That's everything. What would you do if you had a pain in your foot or your leg?
I'd go to the hospital with my GP.
Okay, great. Thanks very much. And if you had a pain in your foot or your leg, who would you go and see?
You just.
You come and see me. These are all friends. Alan runs the coffee shop. Christina, Pamela's the bookkeeper. She works in my business for the last 2-3 years. She doesn't know what orthotic is. She doesn't know what it is. She doesn't know what we do. People do not know what we do. And we talk to them like we think they do, okay? Plus then we also rely on referrals from GPs. GPs don't understand really what we do. That's why we get poor referrals from them. Patients want the outcome. And then, so my journey over the last number of years in terms of trying to talk to people technically has been how are we going to make people in better informed choices about their health, okay? So when in private practice, you all have websites, yeah? And it all talks about gait analysis and biomechanical assessment. So when a patient comes onto the website, they look at it and they get confused. They don't know what you're talking about. Over the last number of years, we've changed the way we talk to patients. We used to fix foot problems. We don't fix foot problems anymore. We help people keep active and mobile, away from painkillers and avoiding surgery. We've all had patients who have sat in front of us with problems, and you're looking at them going, hold on, tell me again how long we've had that? 2 years? You know, what? You know, it isn't that they didn't want to get fixed. They didn't know what to do. They didn't know who to see. And people make choices. We're very irrational in what we do. Something has to get to the stage where it's nearly impossible not to get it done. You get a toothache, you think you'll put it off for a week or two. It gradually gets worse. You know you're going to have to see the dentist. It reaches a sort of peak, and then they make a decision to come to see you. That's the journey that patients go on. Patients who sit in front of you with a bag full of orthotics or have an orthotics from someone else, you're thinking, why didn't you go back to the person that you got them from originally? The thing is, they have tried to get fixed, and they think it's their fault that they didn't want to go, that they didn't get the problem sorted. So we're going to have to start talking to patients differently. Patients live on Facebook. That's where they get all their information, and from Google. And if we're not there with the message of how we can bring them along on that journey, then they get confused, and that's why they don't choose us as their preferred person to help them. Over the last number of years, we talk to patients differently. You need to find out really what the patient wants from them. The main 5 things that people want to avoid are, can't find the card with it on it. People don't want surgery. That's what their real concerns are. When you actually, people will really deep down tell you why they're there, then you can talk to them. People don't want surgery. That's what they're worried about. They don't want to take tablets or medication. They want to keep active and mobile. They want to know what the problem is so that they can actually deal with it, because not knowing is a real major concern for patients, because again they get confusing information. The doctor says this, their lady down the butcher said that, their sister said this, somebody else had another problem with that. They read online, they get worried and they get confused. And it's not that they do not want to get the problem fixed, they don't know which option to take. Yeah. It's a little bit like your journey to Sligo. When you saw the Firefly conference advertised, just think about the choices that you made. You saw the conference, you looked at the website, you checked out the B&Bs or the hotels, you looked at the flights, you thought about it for a week or two, you had a chat with the friends, you went back to the site again, you did different things, and then you got your credit card out and made the choices. If you're naive enough to think that a patient doesn't go through that journey in terms of how they end up sitting in front of you, this is what we all do. But we think that patients don't make those choices. They just think that automatically they're going to end up in your clinic knowing what you do, and then you're going to sort of start to fix them. So patients have all these options. They go to see the GP, take tablets, get the brace off the internet, go to the chemist, see a podiatrist, and they have all these choices, and it's difficult for them to make them. So what we have to do is talk to patients differently so that when they do come to decide to actually get the problem fixed, that they're going to make the choices to come to see us. That's it. That's it, basically.
Take home message. Thank you. Perfect.